How do we find brain aneurysms? Most cerebral aneurysms are found either during imaging scans for other medical conditions, or aneurysms often go unnoticed until they rupture or burst. If you or someone you know has experienced a severe thunderclap headache or has other symptoms related to a ruptured aneurysm, your doctor will order tests to determine if blood has leaked into the space between the skull and the brain, which is called the subarachnoid hemorrhage. We use several types of imaging to diagnose brain aneurysms and determine the best treatment approach. One imaging test is called a CAT scan or CT scan, which stands for computed tomography. This quick and non-invasive scan is often the first test a doctor will order to determine if an aneurysm has ruptured, causing a subarachnoid hemorrhage. CT uses X-rays to create two-dimensional images or slices of the brain and skull. Sometimes dye or contrast is injected into the veins during the CAT scan to look at the arteries and see if there's a possible aneurysm. When injected with dye, a CAT scan is called a CT angiography or CTA. CTAs can show the size, location, and shape of an unruptured or ruptured aneurysm. Sometimes we use this CTA to follow if aneurysms have grown over time or how they are doing in the years after an aneurysm is treated. Magnetic resonance imaging, or MRI, is another imaging type. An MRI uses computer-generated radio waves and a magnetic field to create 2- and 3-dimensional detailed images of the brain. This is a great imaging technique to look at brain tissue if there is damage or blood present. Magnetic resonance angiography, or MRA, produces detailed images of the brain arteries and can often show the size, location, and shape of an aneurysm. Since MRI does not use X-rays, there's no radiation like in CAT scans. This makes this a great choice to screen patients with a family history of aneurysms, such as in their parents or sibling, or to follow changes in aneurysms when scans are needed annually or at times in the future.